10 seconds. Go.
Welcome to the COVID313 Coalition for Families and Students. It is great to be with you today. My name is Christine Bell. I'm the proud Executive Director of Urban Neighborhood Initiatives and also a proud member of this coalition. We have a really exciting town hall today. We have some amazing young people with us today that are going to talk about mental health. And so before we get started, like always, we want to make sure people get to the right place. And we want to make sure that you all know that we want to hear from you. And so you can put your questions or comments in the Facebook chat, and Brooke and Michael and Lindsay are all there waiting to hear from you. We are also, I think for the first time in almost 2 years, we are also streaming to Instagram. So go to Congress of Communities Instagram, and you will be able to see this town hall there, and you can put your comments and questions in the Instagram. I think it's called a chat. This is showing my age. You can ask your questions there, and also and put your comments. Just to make sure that we're all on our toes, all of our moderators are on their toes. Let us know how you heard about the town hall today. And while you're doing that, we also want to make sure that we get people into the right places so that they have access to the town hall in a language that they're comfortable with. So we're translating the town hall to ASL and to Spanish. So Julie is with us again today. It's so good to see you, Oh, it's Jennifer. Hi, Jennifer. It's good to see you, Jennifer. Could you please share the instructions for ASL interpretation? So go ahead, Jennifer.
There really isn't any. If you guys have me set up as a panelist, then I should show up when you're talking at the same time. Okay,
and just to remind everybody, we will be recording this video with closed captioning for viewing later. So, and then Christina, will you please join us and tell our viewers how they can listen to Spanish interpretation?
Good afternoon, everyone. Buenas tardes todos. Si quieren escuchar la charla de COVID-19 en español, por favor, vean en el chat y hay un enlace, o también vayan al Facebook de UNI y lo pueden ver, y ahora por primera vez también con Congreso de Comunidades en su Instagram en vivo, también ahí está la reunión en vivo. Gracias.
Thank you, Christina, and thank you, Jennifer. Just as a reminder for our experts today, please remember to speak slowly for our translators. They want to make sure that they're translating the really important information that you're sharing correctly. Also, turn off your camera when you're not speaking to ensure that the ASL interpreter can be seen. Please mute yourself when you're not speaking. And I believe that Molly is our timekeeper today. So keep your eye on the chat. She will chat you your remaining time. And if you're going over, Jametta or Tracy, who is our other co-moderator today, will come on and gently remind you to wrap up. So without further ado, I am very honored to introduce Tracy, who is one of our co-moderators today for our very special youth town hall. So Tracy, the mic is yours.
Hi everyone, my name is Tracy Gallardo. I am the mental health specialist at Urban Neighborhood Initiative. So thank you for inviting me to help moderate today's town hall. So today I am going to be going over what mental health is. The presentation was completed by Yaritza, who is a youth from Congress of Community. Unfortunately, they're not feeling well, so I'm here to help do their part. Just going to share my screen quickly. Please let me know if my screen is not able to be seen. Perfect. So mental health. So what mental health is a person's condition in regards to their psychological and emotional well-being. All this pressure seems to be affecting his mental health. Well, how important is your mental health? Your mental health can affect you in different ways. Having a nervous breakdown, mental breakdown can cause stress emotionally and mentally. This can affect the way that you have your days, and you should take your mental health serious. If you don't, you may develop depression or anxiety. Are there symptoms to notice if you're not in a good, healthy state of mind? Being overwhelmed is a symptom that can affect your mental health. Being overwhelmed, you can develop anxious or depressive feelings. A few examples include are worrying, having insecurities, having low self-esteem, having loss of motivation, insomnia, extreme fatigue, such as sleep or being tired more than usual, having trouble concentrating, crying, having feelings of anger, feelings of hopelessness or worthlessness, as well as thought of self-harm or suicide. If you're someone who would have thoughts of thoughts of suicide or self-harm, make sure to talk to someone you trust and know that you are not alone. Yep. I do apologize. Just want to, I think my screen froze. And with that being said, I do want to introduce Taikisha from Local Circles. She will be going over statistical information based on the research she has completed recently. So Taikisha.
Hello, my name is Taikisha Boyer, and I'm a youth researcher with Local Circles, and we conducted research by 2 different ways, which was surveying and interviewing. And I surveyed teens my age, and I found out that listening to music and talking to family and friends really helped them during the pandemic and with their mental health, and effects that negatively impacted them were a decline in grades and feeling isolated, that they didn't really want to talk to people, and they had trouble like working with people, and it was just a negative decline in their impact with the pandemic. And people had to stop doing things and start doing things, such as some people had to quit jobs and some people had to get jobs in order to help their families during the pandemic. And mental health is very important. And with the pandemic, there was a big impact. And with the results shown, I seen like what helped them and what didn't help them. And with the decline of grades and with the help of like talking with people, that really helped them. And I recommend that there be more professionals in schools or centers so that people can talk one-on-one with professionals so they can feel more comfortable. And I feel like talking with someone improves your mental health. So I feel like that really helps. And teens really struggle with anxiety and isolation. And with this research and the data collected, we're going to continue with the action plan to reach out to the teens and figure out what will best help them. So yes.
Thank you, Taikisha. Thank you for all that information you found out in your research. We are going to be moving on to urban neighborhood initiatives. We have two of our mental health advocates here who will be presenting information of the impact on COVID on youth mental health. So we have Alma Varela and Kathleen Longoria.
Hello, everyone. I'll be starting this off. So for our topic today, it's normalizing mental health, presented by mental health advocates, me, myself, Alma Varela, and Kathleen Longoria, which I will be passing it to.
Thanks, Alma. So, hello, everyone. On this slide, I'll be explaining what normalizing mental health is. Normalizing mental health means it is something that everyone goes through and that you are not alone. I myself have gone through moments in my life where I felt anxious, stressed, irritated easily, and hopeless. So therefore, normalizing mental health encourages people to talk about it and get the help that they need. It also encourages organizations to invest more into mental health programs. It's really important that we take care of our mental well-being.
In this slide, I will be talking about COVID impacts on youth and young adults' mental health. Some common psychological reactions toward the COVID-19 pandemic have been feelings of fear, anger, sadness, worry, numbness, and frustration. Changes in appetite, energy, and activity levels, difficulty concentrating and making decisions, difficulty sleeping, or nightmares. Physical reactions such as headaches, body pain, stomach problems, and skin rashes. Social media becoming a big impact. As for myself, I could say social media has become a really big impact within myself. I've noticed since COVID started, I stopped doing things I liked. I started being more on TikTok, on Instagram, and everything. And it's just a more draining progress that happened. You can go to the next slide, Tracy. These are some tips to cope during a disaster. Take care of your body. Try to eat healthy, well-balanced meals, exercise regularly, and get enough sleep. Avoid alcohol, tobacco, and other drugs. Connect with others. Share your concerns and how you are feeling with a close friend or family. Maintain healthy relationships. Build a stronger support system. And lastly, take breaks. Make sure to unwind and remind yourself that strong feelings will fade. Try taking deep breaths and do activities you enjoy. And I'll pass it to Kathleen.
Thank you, Alma. So this slide shows tips for parents on normalizing mental health. The first tip is listen to a child or teen if they want to talk about mental health. Educate yourself about mental health, such as asking health professionals for help. Validate their feelings. Remind them that mental health issues are common. Offer impartial counseling and be supportive, which is being there for them and making sure that they have the resources that they need.
These are resources of where our info was found, but that is the end of our slide.
Thank you so much, Alma and Kathleen, for sharing information how COVID has impacted youth mental health. So we are going to be introducing Jessica and Shurabi from 48 to Forward Youth Organization.
Hi everyone, I'm Jessica. Sorry for the darkness. I'm with 4 to 4 Youth Collective. So 42 Forward Youth Organizing Collective has decided to launch a campaign with youth in Detroit and across the state to win at least $100 million for mental health counseling. Did you know that the current ratio of students to counselors is 1 counselor to 671 students? That is the 49th worst ratio in the country. And all of those counselors are not mental health counselors, but guidance counselors.
Currently, the governor has $361 million proposed for mental health in the state budget, but it is not guaranteed that it will be included in the final budget. We are asking youth across the state to sign on to our petition to the Senate Education Appropriations Committee to ensure that we get at least $100 million this year for more counselors. If you are interested in joining 42 Forward in our campaign for more money for counselors, join us by signing on to this petition that I will drop the link to in the chat.
Thank you so much. So we have La Vida, we have Riley Diggins, who will be going over mental health and domestic violence. Riley Diggins?
Good morning, everyone. My name is Riley. I am currently an intern with La Vida Partnership. Okay. So today I will be talking to you all about youth mental health and connecting that to Teen Dating Violence Awareness Month, which is actually February, and just connecting that to youth mental health. This is our grant statement. So first I want to start by talking about teen dating violence. It can go by a lot of different names: dating abuse, intimate partner violence, relationship abuse. All of those things fall under this category, and this is a pattern of destructive behaviors used to exert power and control over a dating partner. So abuse can look like a lot of different things. It's not only physical abuse. There is also emotional, sexual, financial, social, and digital abuse. One thing that we have seen a rise in with COVID and increase in technology and using social media is digital abuse. So I just wanted to highlight some signs that digital abuse may be happening. It can look like a partner asking you to share all of your passwords to your social media with them, forcing you to share your location, reading all of your text messages, telling you what you can and cannot post on social media. Those are different signs of digital abuse. On the right here, we have the teen equality wheel, which highlights some characteristics of a healthy and mutually satisfying relationship. So some of those things include trust and support, fairness, respect, non-threatening behavior, accountability and honesty, and shared responsibility. So those are signs of a healthy relationship. Some things to look for maybe in your own relationships or with a partner, whereas on the left we have signs of different things that are ways that a partner could be abusive. So I wanted to share some statistics about teen dating violence. So 1 in 3 people will be in an abusive or unhealthy relationship. Roughly 1.5 million high school boys and girls in the US admit to being intentionally hit or physically harmed in the last 3 years by someone they are romantically involved with. 33% of adolescents in America are survivors of sexual, physical, verbal, or emotional dating abuse. Females between the ages of 16 and 24 are roughly 3 times more likely than the rest of the population to be abused by an intimate partner. And only 1/3 of the teens who were involved in an abusive relationship confided in someone about the violence. So some things that I want to highlight about these statistics: if you are a young adult or a teenager viewing this session, I want you to know that you are not alone in these experiences. Unfortunately, there are many people who have had these experiences, and there's also significant support out there for you, which I will cover a little bit later. But I want you to know that you are not alone. And also on this last point, that only a third of teens who were involved in abusive relationships confided in someone about the violence. Something that we have seen is that sometimes youth are afraid to share with their parents about any abuse that has happened to them because maybe they weren't supposed to be in a relationship, or they weren't supposed to be at a party, or they're afraid of just being blamed for the situation. So for parents, be supportive of your teens. If your child confides in you about abuse, be supportive to them. Connecting this to mental health. So according to the CDC, youth who are victims of teen dating violence are more likely to experience symptoms of depression and anxiety. They're also more likely to engage in unhealthy behaviors like using tobacco, drugs, and alcohol. They're also more likely to exhibit antisocial behaviors like lying, theft, bullying, or hitting. And they're also more likely to think about suicide. So it's important to recognize these signs so that you can talk to those who you are close with about their relationships to ensure that they are in healthy and safe relationships. So through this presentation, you may be feeling that you know someone who might be in this situation, or you yourself might be in this situation. So we want to give you all some tools on how to help. So first, you can speak to the victim in private. This is a really sensitive conversation and something that can be scary or hard to talk about. So having this conversation in private is what we recommend. We also recommend approaching with care and kindness. Being in an unhealthy or abusive relationship can be a really challenging or scary thing. So approach the conversation with care and kindness, letting the person know that you are there for them, that the abuse is not their fault, and that you'll be supportive. Additionally, do not be judgmental. There are many reasons why people may stay in one relationship or another, so it's important to not judge, but to be supportive and let the person know that you are there for them. Also encourage them to build a wide support system. So this may look like inviting them to different things that you're going to, maybe a party or a hangout. This could also look like encouraging them to get involved in different clubs or activities that they might be interested in so that they have more people supporting them. Another piece of advice is to encourage them to seek out help from a domestic violence agency and or hotline. I will provide some resources for those things, but through these programs, they can receive additional support from a professional. So some things for youth. The first is to know your community resources. Just maybe do some research, see what things are around you, just so you know if you ever need to access them. Also remember that in domestic violence, sexual assault, and dating violence, and stalking, a lot of these crimes are generally committed by individuals who have a previous relationship to the victim. And this can make pressing charges more challenging. So one, it's important to be aware of who you're in relationships with and to have healthy boundaries with those people, but also understanding that if you know someone who may be in this situation, they may not want to press charges because of their relationship to the person. Also know that youth can access counseling resources without the consent of a parent or guardian if they are over the age of 14 in the state of Michigan on a limited basis. If that is a concern of anyone, you can still receive resources without the consent of a parent. So that's just something that's really important to be aware of. Also, youth can also obtain a personal protection order or a PPO without a parent or guardian in the state of Michigan, as long as they have an adult who is willing to represent you in this way. So those are just some things to know and think about as we talk through this. With La Vida, we have two different groups. We have the Youth Board and the Amigas group. So the Youth Board is for youth ages 14 to 24. We advocate for domestic violence and sexual assault awareness by putting on events and just having conversations, bringing it to schools and those kinds of things. And we meet monthly. And then Amigas is a group for adult women. It's on Mondays from 9 to 11 at Chas Center. This is a Spanish-speaking group. We ask that children do not attend, and there are 10 repeating sessions. So if you come to the first one and it's in the middle of one of the 10 sessions, you can keep going till you fulfill all 10 sessions. These are some resources for youth. It's a crisis line of support. So if you go to loveisrespect.org, I believe they have a chat box and you can talk to different peer advocates that way. They also have a hotline that you are able to call, and you can also text love is to 22522, and that can get you connected to advocates and people who can give you support. This is our information here at La Vida Partnership. We are open from 9 to 5. So if you have any questions, you can reach out to us as well, and we'd be happy to support you.
Thank you so much, Riley. So now we're going to transition to resources in closing. So up next, we have Alma, our mental health advocate from Urban Neighborhood Initiatives, who will be sharing top resources for mental health support for youth. Alma?
Hi, everyone. I'll be providing these resources that Tracy's going to put up. So one of the resources we have here is https:/starwritebooks.com/blog. I'm going to have Tracy click on it so you guys could get a view of it if you can. So this is what it looks like when you click on it. It's one of our resources that it's a good source. If you mind scrolling down just so you guys can get an idea of how it looks like. Okay, that should be good. Another one we have is the https, if I'm not wrong, DWIHN. If you mind clicking on it, please, Tracy. This is what you'll see when you click on the link. Do you mind scrolling down a bit, Tracy, please? Okay, that should be good. Thank you, Tracy. And we also have a call center, which is here. The link is here. And go ahead, Tracy. So this is what it looks like. Okay. That should be good, Tracy. And we also wanted to include the other one. Go ahead. I just wanted to show these links out so you guys can have an idea of what they look like. Okay, that should be good. And I also want to include that if you are a teen 14 and up, you can have up to 12 sessions or 4 months of counseling without parental consent. That is within the https dwihn.org access call center, as well as local awareness, and it's a national crisis line, and the MDHAS certified peer support specialist warm line, which is 888-733-7753. It's open at 10 a.m. through 2 a.m. 7 days a week, and it's located in Michigan. And the Macomb County Crisis Center, which is 586-307-911, and it's always open 24/7, and it is located in Michigan. Those are some resources.
Thank you. We will also be sharing a resource page that will be shared to everyone on the call. Under it's gonna have like different local resources in the city of Detroit, as well as national hotlines that Alma has shared. So thank you, Alma. So we are gonna be taking in any questions that anyone that's on the call that would like to ask any of our youth today. Um, so for the youth that are here on the call and that presented, a question did come in, and we want to see if you could all, if some of you could unmute yourselves and answer the question. So let me find a question for you all that the audience had for us. Okay, so what can you tell as well as advise parents about dealing with their children's mental health? Again, if any of the youth who presented today, who would like to answer that question? And again, just I'm gonna share out the question again. What can you tell or advise parents about dealing with their children's mental health? I see Takesha.
What I'll say is like the parents should like ask their kids what they're going through and try not to be so offensive or like try not to say what's like it's such things that the wrong thing to say and the right thing, but just try to be understanding. Don't just be too quick to say, oh, you can be this way or you can be feeling that because you never know what they're feeling like. You just have to be understanding and put yourself in their shoes. So you have to step down as your parent role and be like a mentor type of.
Thank you, Takesha. Alma, I did see you turn your camera on. Did you have something to share as well?
Yes, I was just going to say to not lose hope in it and like in us or in your own child, to not lose hope and to keep trying because it'll be something that'll benefit your relationship with them and as well as one another. So just be patient. It's a progress thing and it's a good result in the end.
Thank you so much, Takesha and Alma, for that advice for parents. Also, another question that we have for you all, to all our youth presenters, is what do you want other youth to know right now?
I would say one thing I want youth to know is that they're not alone, that we're all dealing with these things and it's totally normal and it's okay for you to reach out for help. It's better to reach out for help than to stay alone. So if you need help, seek help. It's normal. We've all been there and we're all proud of you.
Thank you so much, Alma. We do have another question on here. Again, if any of our presenters don't mind sharing, have any of you or your friends worked with youth therapists or counselors at mental health agencies? If yes, what was your experience?
So I have a friend who went to therapy, and she told me that it's really great for her and she feels very comfortable with her therapist. And it's really, really great for her. And I noticed that she is getting the help that she needs and the advice from her therapist. So it's really, really good for her.
Thank you so much, Kathleen. Are there any other questions that anyone wants to ask our youth who presented here today? Okay, we do have another one. So what programs or people at school have been most helpful for mental health? So what are programs or individuals at schools have been most helpful for mental health?
So for me, the people at school that are most helpful for mental health are sometimes teachers, because some teachers understand that they were a student before and that students have a lot of problems in schools and that they have mental health issues. So they're able to offer firsthand support and firsthand experience from when they were children. So talking to a teacher always helps if you don't have a mental health counselor at your school yet.
Thank you, Shirabi. It just sounds like just being able to have that mutual support was what helped your peers. Thank you. Also, there is another question. What mental health resources or activities would you like to see in schools or that community agencies can provide after school?
I would say I would like to see more support within students, as in more counselors, and just having them being more supported within the students, because now there's not really as much support and it's the lack of staff. So I would definitely say more support and just more people to help us out.
Thank you, Alma. Jessica, do you want to share what mental health resource activities would you like to see in schools or that the community agencies could provide after school? Okay. All right. Is there any other questions from the audience? Oh, there's another one. What does support look like to you? And if you have a magic wand, tell us any idea. So what does support look like to you?
Support looks like to me getting support from your family, organizations, religious communities, like having someone to talk to and be there for you. So having like a whole community by your side, and being able to reach out to people who will be there for you at all times. Yeah.
Thank you, Kathleen. Anyone else? What does support look like to you? And if you had a magic wand to have it happen, what would it be?
I would like to say that support looks more listening than criticizing or giving advice, because sometimes we're so fast to just give advice or, say things, but sometimes listening is more than enough. So definitely listening and keeping us in thought.
Thank you. Surabi, do you have any final remarks of what does support will looks like to you?
To me, support is people around you. It doesn't have to be just a therapist or someone who is qualified. Even though that is better, support is just people that are around you that build you up. Like if there was a way to create a space where everyone could come together that, may be feeling down, or they might have like similar issues to talk about, such as the pandemic or anything, they could come to that space. I know we have these virtual spaces, but in-person support is so much better when you can actually talk to the person and actually experience like other emotions, and it just works way better in person. So in-person space like that would be great.
Awesome. Thank you so much. So we now invite Jamita for closing remarks.
So I really, really want to thank all of the young people, and especially when you shared what does support really look like. And it varies, doesn't it? And I just want to thank for those of you who said that sometimes just listening and having someone to hear you can be therapeutic and help you feel good. So want to thank all of you for coming, for doing your research, for being willing to share your voice and share your thoughts about our emotional as well as our mental health. And so I just want to, as we get ready to wrap up the program, again, so many thanks to our young people, and a reminder to all of us as adults, whether we're big sisters, we're nanas, we're moms, we're dads, we're uncles, is that this is an extraordinarily challenging time. And to our young people, I was saying, if you think it's rough at your end, think about people at this end and the people at that end, thinking about folks somewhere else. We are all in an extremely difficult and challenging place. So let's love on each other. Let's listen to each other. And when we think that we have the need for more resources, like one of our presenters said, don't be afraid. Make that phone call, because asking for help with your emotional or mental needs is no different than you cut your finger and you want somebody to put a Band-Aid at it. You broke your leg and now you need crutches. Well, a lot of times what happens in our heads and in our hearts, people don't see that. So it's up to us to reach out. And for those that love each other, that we are paying attention to each other. So it's really in that spirit that, again, we're thanking you, and we are wrapping up another program that we hope has been useful for all of those that are out in our community as we're trying to cope with this thing called COVID, and ongoing that we really do not have enough resources to address the social, emotional, and the mental health needs of our community, let alone our youth. So youth, we want you to know we are with you in the battle to make sure that particularly that there are strong and consistent voices of support for you. So where can you go to get some help? Well, one of the things we want you to all know, families, is that there is a system out there of organizations as well as agencies that you can tap into. This list comes from the Michigan Department of Health and Human Services. That's at the state level, and they have the responsibility of making sure that there are resources all across the state. So if you look at this list, there's an association for children's mental health. We encourage you that with each one of these, that you go to those websites and check them out. We also are better understanding the effect of trauma. I mean, what does it mean that we are hearing and we know that our children are witnessing the deaths in their household, in their family, not just the COVID, but what we just seen the other day, ongoing gun violence, ongoing, thank you, Chaz, domestic violence. That's traumatic, that's stressful. Please know that you can get the resources to think about, to help you or help your neighbors or help your cousin be able to cope. Please take this list. Other resources that are really important, we want you to know that at the county level, there's an entity called the Detroit Wayne Integrated Health Network, sometimes called DWIN. They are the organization that assures and has the responsibility of making sure that there are resources that are preventative all the way to when children or adults are having what we call a crisis, whether that means that someone has not been taking their medication or needs medication, or if you feel threatened, they please call those hotlines. There's a helpline and there's a website and there's telephone numbers, and they can connect you to the mental health agency that is closest to you, because there are over 15 just in the Detroit Wayne County area that are here for children and for youth. Make sure too that the reality is that some of our children are getting expelled. And rather than perhaps that educator finding out if there's something emotionally going on with that child or that young person and why they're acting a certain way, they're getting expelled. And to help address those kind of issues, students as well as adults, you can call the Student Advocacy Center of Michigan. They understand, they can help intervene, and really importantly, perhaps help you not only get the support your young person needs, but to have a conversation with that school, with that program, so that your child gets the support that they need. And of course, we realize that we have children who have special needs. And maybe not special needs, they are extraordinary children as well as young people. And the Autism Alliance of Michigan is a resource, not just if you are on what we call the spectrum, but you may have another special need. The Autism Alliance of Michigan can give you that connection. And of course, there is the Alliance for the Mentally Ill. Those are for families and young people that are struggling to get the resources they need. They've had a diagnosis, they need some help. Please contact the Alliance for Mental Health, and particularly the mentally ill. So these are all important resources, again, to build us up and to remember that our heads and our hearts and our bodies are connected. That's why they call it integrated health, by the way, physical health and mental health together. So while we're talking about mental health, part of what's going to make us healthier, right, is if we are focused in on our freedom and on understanding that we have to engage and inform and advocate to legislators. And who would better to do that than our young people? So 4824 is having a lobby day. Get ready, adults and youth. Go to the lobby day. You can register now with 4824, who every day, 365 days of the year, is about empowering our young people and adults with information to get out the vote and address legislation and the other kind of change that we need. Next slide. Coming up, and I love this title, Show Me the Money Day. In other words, what we're pleased to show is that the United Neighborhood Initiatives, UNI, one of our co-moderators and part of our COVID313 coalition, is doing a workshop on financial literacy. So the reality is that we cannot have economic mobility and attain what we are looking for our quality of life unless we understand money. And we have a better understanding of how to create a budget and how to deal with banks or not deal with banks and not get caught up into these phone calls that say, call me now and I will loan you $10,000, and they don't tell you how much the interest is. Want to know more about that? Go to Show Me the Money Day with UNI. The information is right there. And that is a partnership, by the way, because that's how we do what we do. With COVID313 partners, we partner with other folks. So UNI is working with PNC and many others that you see on the bottom of that slide. And so really pleased to say that we're talking about power because information and action is power. The Detroit Parent Network, as part of our Sankofa, we are 20 years old. We are a 20-year institution, and we are doing our own process of Sankofa, which means to go back and fetch it, looking at our past and using that past information to inform our present and to carve the future that our children deserve. And who better to help us with some of that is the phenomenal woman, Alice Thompson, who is a treasure in the city of Detroit, who has been involved in mental health and educational outcomes for decades. And many of us know her as a powerful social worker and educator. Come have a conversation with her along with our parents, Powered for Policy Change. We're gonna be talking about educational equity and excellence and how do we make sure that we pass this legacy on to our children in all that we do. Continuing the theme of education and understanding that literacy is liberation, Detroit Parent Network is continuing our 3rd grade reading law workshop. We've all heard about it. It's the law that says if your child is not reading at a certain level by the 3rd grade, they can be held back. Guess what? That law, it still exists. Although in most cases, and certainly with the Detroit Public School Community District, Dr. Beatty, as well as many of our charters, are not holding children back. But are looking at how do we get the resources to the family so that that child can improve. This workshop is still to help you understand the law, and very important, parents, what do you do with these things called individual reading improvement plans? So bring your questions and bring your young person, because we're going to talk about tips of how you can have a literacy-rich environment at home. 3rd grade reading law, and that is tomorrow evening at 6 o'clock. So we got a powerful day on Friday. That we have our Equity Cafe with Alice Thompson at 12. Later on this evening, in that evening, we have 6 o'clock. And on Saturday, we've got something else pretty special. We're calling it our Sankofa Saturdays. And that's where we're coming together again, affirming that literacy is liberation. And we're going to have some fun. We're going to have readers. We're going to have books. We're going to have giveaways from 11:30 to 1:30. Please join us. The registration information is on our Facebook page. You don't have to register, but we'd like for you to register, because if you do, then you are eligible for the drawings that we'll be doing of some gift certificates to Black-owned restaurants right here in the city of Detroit. So join us on Saturday, our Sankofa Saturday from 11:30 to 1:30. And one of our other important partners and part of our backbone for this initiative is Detroit Public TV, which is a part of the national public broadcasting. And we know that they're providing information and education for all of us for decades. And we want to thank them because they are wrapping up and doing a host of programs that they've been doing part of their African American History Month and getting ready to start looking at Women's History Month. On the screen this Sunday, that you can see the 1 hour special that is part of the American Black Journal, specifically has been looking at the historical and critical role that the Black church has played, not only in its impact spiritually for African Americans, but as a leader around the morality and the social justice that has helped move this nation forward. Join DPTV for that. And that's going to continue not only talking about the Black church in Detroit, but then real specifically in March, join for a watch party. In other words, get your coffee, your tea, sit down and have a conversation as women talk about what is womanist theology, and understanding that women are a fundamental part of who we are spiritually, and our leadership and our voice needs to be part of the solutions that not only religion as a institution, but how women are so important to the spirituality of our communities and our growth. So with that, we've got one last item or two. Oh, this is great. Thank you. We've got some learning and some fun. We're in COVID, but it doesn't mean that we can't have fun virtually. So please join the Wayne County Community College District Kids College. They're having a program, and we want you to please make sure that you put that on your agenda. Wayne County Community College District. Families, make sure that we're showing our babies now that college is available to them and should be just as natural as we talk about watching a basketball or football game. We should be talking about, so what college and what program are you going to go into? Do we have any more announcements for our wrapping up of February, which is African American History Month, and we're getting ready to go into Women's History Month. So to the young women that were part of our mental health from a youth perspective, again, thank you. Thank you for sharing your power, your voice, and thank you, all of you. This is Jametta Lilly. Again, I'm so blessed to serve as the CEO of the Detroit Parent Network. I am a proud member of the COVID313 Community Coalition, and proud to be with all of you as we are all combating COVID, combating racism, and creating the future that all of us need. And with that, have a blessed day. Thank you. Okay, so you know what this means now. Everybody's got to come on screen. You know how we do what we do.
I think we're clear already. Wes cleared us. Or not yet, not yet. He said cleared. Just kidding. Come on the screen. He got tricked.
That's funny. I was going to say, so he cut me off 15 minutes ago. I've been just talking.
No, he said clear about 2 seconds ago, but we're still on, he says.
Okay, it's all good. It's all good. There's some of you, we cannot see you. I won't call out your names, but in COVID, it doesn't matter how you show up. You got to show up. So, okay, okay, there you go. I see you, Michael, and others. This is part of our mental health, right? That we can look at each other and say, oh God, look at your hair. Oh, look at, what are you wearing? And Molly, like, what's that on your back wall? Yeah, I'm doing this because it's about how do we love on each other? How do we help each other laugh to do the work that we got to do. And that's going to help us get through. Okay. Are we going to get cut off? All right, wave everybody. Take care. Be blessed.